Welcome to Regional Cancer Care Associates, or RCCA. I'm Dr. Ellen Ronan, and I practice hematology and medical oncology with RCCA at the Central Jersey Division. You're watching this video because your doctor has prescribed you a course of chemotherapy as part of your treatment plan. Chemotherapy raises a lot of questions and concerns on what to expect. Hopefully, this video will answer a lot of these questions. The information covered will also be discussed again at many times during your treatment journey. We will talk about the different types of therapy that you might have been prescribed, including oral chemotherapy, standard IV chemotherapy, and immunotherapy, and the details of each. Here we will go over the step-by-step process of receiving chemotherapy in our office. Up to this point, you have probably only met your doctor. We have a team of staff who you will now learn more about who are dedicated to making your treatment a good experience. Let's begin.
After your physician has prescribed a chemotherapy treatment for you, you will sit down with a nurse practitioner or physician assistant for a visit called the chemotherapy educational session. During this visit, which is 40 minutes long, we will go over your treatment schedule, what to expect, how long your treatment will be, and all the possible side effects that you may experience when you're undergoing your treatment. We will go over all the prescribed medications, including nausea management or diarrhea management. We will go over any oral therapy that you may be prescribed, how to handle the pills at home, safe handling of those pills. We will go over any food-to-food interactions or any food-to-drug interactions. We will talk about how to handle a missed dose. You can call us at any time with any questions or concerns or any symptoms you may be experiencing. Lastly, we will go over the education on other topics such as nutrition, emotional well-being, fertility, mental health, and any other specific issues or concerns that you may want to talk about. Before you leave, we will review when your next follow-up is and when we will see you next.
The first day is always the most nerve-wracking. When you come in, we have you sign in at the front desk. They'll switch you over to the waiting room so we know where you're at. We have to do blood work before each treatment because the treatment will affect your blood work. We want to make sure everything is okay before we continue. So someone from the lab will call you over. They're going to poke your finger for the blood work. We get the result pretty quickly, so we'll know where you're at within a few minutes. Once the lab work is in, we'll take a peek at it. As long as everything is okay, we'll pull you in. After that, we'll call your name, we'll pull you into our treatment room, and we'll get your vital signs and we'll get your weight. So as long as your vital signs are okay and your lab work is okay, we're gonna have a little chat. That time would be when you would tell us how you're feeling, if you're having any nausea or vomiting or any symptoms. As treatment goes forward, you may start to feel some symptoms, so that's when you bring it up to us so we can bring it up to the doctor. We have to get the orders approved by the doctor before each treatment. So we'll bring your blood work, your vital signs, any signs or symptoms, we'll bring it up to the doctor, and it'll be up to them to decide if they wanna change the dosage, if they wanna hold, or if they wanna continue further. Once the orders are approved by the doctor, we hand it over to the pharmacy because we mix the medications on site, so they will make the medication. And then once it is checked by a pharmacist and a nurse, and then a nurse-to-nurse check, we'll bring it over to you and we will get the treatment started.
I try not to overwhelm the patient with this initial introduction on my part because they've just heard this diagnosis, they've just heard this plan. I just want them to know where to come and to see a familiar face.
Patients can bring their own snacks. We encourage people, bring whatever you want to eat or drink. Some people even order out because we have so many restaurants in the area. We have blankets, pillows. You can bring all the comforts of home.
Cancer treatment is now undergoing a shift from intravenous to oral therapy. In many cases, the administration of cancer therapy has moved from a medical facility to the home. Although taking medication at home is more convenient, now the patients and caregivers are responsible for ensuring that the patient takes the right drug at the right time in the right dose. This is why the chemotherapy education session is so important. At this session, we discuss the medication and the side effects, as well as how to handle any missed doses, the safe handling, storage, and disposal of the medications. We also provide the patient a calendar so that they can write down the actual dose and how to take it and on what days, and we answer any questions that the patient and the family might have. At this session, we emphasize that the patient and family member should call us with any new side effects. They should not wait for the next follow-up office visit to tell us about anything they're experiencing. And before they leave at the chemotherapy teach, they should have a schedule of when they come for follow-up, blood work, and office visits. Oral therapy should be stored separately from other routine medications. Each manufacturer has separate guidelines for how to store their medications. Some medications need to be kept in their original packaging. And we will discuss each separate guideline at our chemotherapy session.
In recent years, immunotherapy, which harnesses the body's own ability to fight disease, has played a growing role in the treatment of many cancers. Immunotherapy is different than chemotherapy. It works differently, and as a result has a different set of side effects or adverse reactions. Immunotherapy may be used along with, following, or instead of chemotherapy. If your doctor has prescribed an immunotherapy for you, the nurse practitioner will review pertinent information, such as how it works and what to expect at your teaching visit. One key point to bear in mind, however, is that it's important to monitor for and promptly report any side effects or things that are different for you. Side effects of immunotherapy are different than chemotherapy and are also treated very differently.
We hope that this video has answered many of your questions. Your RCCA team is committed to your health. Please never hesitate to ask any of us your questions when they arise. Thank you for watching this video, and thank you for entrusting your care to us.